I want to welcome everyone to our webinar, Utilizing the South Carolina Data Book to Your Advantage. We have with us from ICS, Amanda McDougall-Scott, Megan Carolyn, Sean Rusnick, and then also we have our Vice President and General Counsel, Brian Burrows, and Mary Garvey, our Director of Inclusion and Innovation. Thank you.
Brian, do you want to go ahead and get us started with an introduction to who we are? I think that we are just about at 2 o'clock, and I know that we have a number of folks already logged on. We also are recording this in full, so if anybody happens to jump in a little late, they'll be able to catch up later. But Brian, you want to get us started?
Sounds great. Thank you, Megan. My name is Brian Burrows. I'm the Vice President and General Counsel at the Institute for Child Success. For those of you who don't already know us well, we are a research and policy organization dedicated to the success of all children. And most of our work focuses on young children, specifically between prenatal through early elementary years. As part of that research and policy work, a lot of what we do is work to build tools that are designed to be helpful for those who also impact early childhood systems. So that can it can be policymakers, it can be legislators, it can be organizations that serve kids, or families, or teachers, and the like. And so this is a tool that we have produced in that vein. I want to take a moment and thank our fantastic team. If you've worked with ICS, you understand that the staff are our product, and they are fantastic. So the lead author is Amanda McDougall-Scott, who is ICS's research associate. We also worked with Sean Rusnick on this project, who's a post-baccalaureate fellow, and Megan Carolyn, of course, who is our director of policy research. And as always, with anything that we produce, there are folks who are integral to putting this work together, including Lisa, whose voice you heard before, and Amber and Christina and Jamie and Mary. And so we couldn't do this work without all of them, and it is a joy every day to work with them. So with that, I will pass the mic over to Megan to kick us off on the substance of the report.
That is great. So just once more, a reminder to everybody that your phone lines will be muted for the duration of the call. If you have any questions, please use the chat window. You can direct them to Institute for Child Success, and we are recording this for posterity and future reference. So Amanda, on that note, I'm going to start your slides, and just give me cues as you need them. Amanda, you can start by doing some of the Data Book 101 and letting folks know what they're going to be seeing in just a minute.
So when the slides come up, the first one is just going to be showing a little bit about the data book. And the question that we asked when we decided to do the data book project was, how are the children in our state? So we wanted to know and be able to provide some data to back up how the children in South Carolina are doing. So we are trying to give an overall picture of the state of overall child health and well-being, given a number of indicators that we pulled out, that evidence-based indicators, that is. So we also like to not only use data for action ourselves, but encourage our partners and friends, anybody else who can use this data book, to use it for action. Now at ICS, we use it to help us define priorities for our research and policy, and then any other avenues that we feel are appropriate given the indicators. The next thing I was going to share is about that there are over 80 indicators that were pulled out about these environmental factors impacting children ages 8 and under. And of course, it's comprehensive, because we know that children don't grow up in a vacuum, and they are reciprocally affected by their environments and the people around them, and different environments that they might find themselves in. So the data book is South Carolina focused, but in order for us to have something comparable to help make sense of the data, We also compare the data in South Carolina to our friends in North Carolina, Georgia, and then the United States as a whole. So the 4 domains that we identified for this data book are family environment, physical health, emotional well-being, and cognitive development. There's no one comprehensive indicator of child well-being that we have identified here, but the well-being spans physical, social, emotional, and cognitive health and development. The very first page is our table of contents. Here is our data book, 2019. And so if you look through it, you'll see how this report is actually structured. So we've got, the intro, the methods, that tells a little bit more about the indicators and how we actually chose them and decided on what we were going to include in the data book. So we've got the state comparisons on the data discussed by domain, and we have an exploration of trends and the importance of each indicator, and then the table is in the back. Which discusses the report by state. And so the beginning of the table is actually on page 27. So that's going to be the hard data, and it has references for you to use when you are looking at it. It also has the domains, as you can see. So the early childhood well-being indicators are based on a peer-reviewed systematic review of the social indicators for child well-being. In your physical copy, if you see page 3, you will see a list of the child well-being indicators. It looks like this. So you'll see we have family environment, physical health, emotional well-being, and cognitive development, and then each of the indicators that are under each of those headings. So the study that we used for this, for selecting these indicators, was one by Elizabeth Pollard in about 2003.
I'm sorry, Amanda, if I can just jump in for a moment. I see that the slides are up now. Can you also confirm that you're able to see them?
I can see them, but it's just on the first one.
Wonderful. Lisa, can you bump ahead to, I think, let's go to slide 4, and then we can figure out from there. Amanda, do you want us to go a couple further?
Well, I'm done with my section. Unless y'all.
Well, there we go.
Yeah. Unless you do want to go through the animation of this, but I just ran through that, and I was actually about to turn it over to you, Megan.
Well, there we go. Thanks everybody for bearing along, and Amanda, very quick thinking in using the visual prop of having a physical data book right on hand there. So we will be sure that in addition to the recording, everybody has a copy of the slides as well. But here you can just see, a graphic version of the tour that Amanda has taken us all on today through the data book. Okay, great. And so Lisa, if you can take us, I think 2 slides further.
Mm-hmm.
Okay, great. And so, as Amanda had shared with all of you, the goal of this report was not data for data's sake. The goal in everything that we do here is to find ways to help improve child outcomes. And so what that means is identifying data indicators and data sources that can be really valuable in charting a path forward for families and children, to letting us know how families are currently doing, for giving us some ways to track progress moving forward on what it would mean to see an improvement in child outcomes. Child outcomes is a very large term. And so the goal of the data book is to help give us some language, some real teeth around that, to have that conversation. So Lisa, another slide, please. And so as Amanda showed you, in addition to a pretty robust narrative that we have where we explore the trends from the data report, the PDF also does have, or the physical copy if you have it, does also have the data table, which is pretty easy to navigate once you get a little used to it. It's color-coded for each state. All of the 80+ indicators are laid out there. A few things that we do want to bring your attention to with using this. In the final column there, we've noted the year of the data source. As any of us who work in the data world know, sometimes the most recent data does not always feel that recent. We made as much of an attempt as we could on this report to have the most recent data, but sometimes that does lag several years, and sometimes that can be really, really important. Certainly with the last edition of this book, that was using data, some of which was from before major national healthcare reforms. And so the things that happen in our policy and economic conditions can very quickly change these data. So it's really important for us to know that you all have that year for reference there. I'll just note two additional things that you can see on this close-up. We've really rigorously documented the sources. That's the parenthetical number, for example, after total population. We want you to be able to go and access the primary sources of these data to be able to use them for your own needs and your own analyses. Maybe you want to compare South Carolina, not to Georgia or to North Carolina, but to Kentucky, for example. We want you to be able to trace back to those primary sources and get the data that you need as well. And you can also see methodological footnotes, which are these letters, superscripts, that our graphic designer just loved adding in manually on so many of these. And that's just so that you can understand any of the caveats that went along with those data sets and their primary sources. Next slide, please. So we've talked a lot about what we've done. What we're going to do now is talk a little bit about some of the findings. So as Amanda said in her introductory remarks, there is no one indicator of child well-being. And that's a real difficulty sometimes in how we talk about this report, because I cannot tell you a top-line finding. There isn't a good newspaper headline in this report because it is so complex and we look at so many different things. And so what I'm going to do, and then I'll hand it over to Amanda to talk a little bit about another indicator, is share some of what we are able to do and learn from this report. So one thing that we're going to talk about is this indicator of risk factors. Now, this is pretty early on in the report that we share this. The National Center for Children in Poverty has developed this list of what they consider risk factors for child well-being. This is derived from research, mostly looking at academic, social, emotional, and long-term economic impacts on children. So these risk factors, as I've identified them, are on your screen. A couple of things with this. First of all, this is one of the very few aggregate measures that we include in the data book at all. For the most part, we really wanted to focus on indicators that you, the user, could calculate or combine or recalculate based on how it suited your needs. And so this is one of the few aggregate measures, but it's helpful to sort of get a quick hit. And before we go on to the next slide, Lisa, could you do 2 mouse clicks for me? Let's talk about the term risk factors. We are the Institute for Child Success. Success means children achieving their best. It does not necessarily just mean talking about what the problem is. And so we are wary of using the term risk factors. We'll talk a little bit more towards the end of this presentation about how deficit thinking and strengths-based thinking both have a role in our policy making. Generally in the world of early childhood, we talk about deficits, we talk about the word gap, we talk about the poverty level, we talk about the income gap. There's a couple of things that happen when we always talk like that. First of all, it can take agency away from people who can achieve real solutions. It takes agency away from families if they already feel like they're starting at a deficit. It also makes it easy sometimes for policymakers to miss a certain group or population. So we are wary of the term. We want to be careful about the term. That being said, we have a combination of indicators in this report that are sort of the more deficit-facing risk factors, as well as more strength-building indicators, and we'll talk some more about that. So Lisa, the next slide. So what does the situation look like right now for South Carolina's children? And Lisa, you're going to have a couple animations to do on this one. So if I can have one click. So this is all of the children in South Carolina under the age of 18. It's 1.1 million children in South Carolina are under the age of 18. That's 1 in 5 residents of the state. About 300,000 of those children are under the age of 5. So the young child population is pretty large. Lisa, another click, please. And that is the number of children meeting 1 or 2 of the risk factors on the previous slide. As you can see, each of these children is 11,000 children. So it's a pretty high number to begin with. Lisa, another click, please. And now 2 clicks. The children in red are the children who are meeting 3 or more of those risk factors. As you can see, this is over half of the state's population are meeting 1, 2, or 3 of these risk factors. And that's a sign right there, without getting into the complexities of what is a risk factor and which risk factors are these. It's a real sign that there could be some opportunities to help strengthen child and family outcomes. If I can have 2 more clicks to help put this in context, this many children is the size of the home stadium at a Clemson football game. I know I'm talking to a South Carolina audience. Sometimes it can be really difficult to put into perspective how many children we're talking about here, because 11,000, 1.1 million, those are very large numbers. And so for us, a top level finding of this report is there is clearly much work still to be done for the young children of South Carolina. And that's where we're starting that conversation today. I'm going to hand it back over to Amanda now, who's going to talk a little bit about the situation for working mothers in the state.
Great, thank you. And there are lots of clicks on this one. Thank you. Okay. So the first thing I wanted to highlight is the number of working mothers in South Carolina, which is approximately 335,723. Also, if you want to follow along in your data book, if you look on page 34, that's the data that I am pulling for this slide. And as Megan mentioned earlier, what I wanted to do here, or what we wanted to do here, is show what calculations and things you can, other takeaways that you can use from this data. So again, starting with the working mothers here, I just gave you the number, and you see the percentage of the single working mothers here is about 26%, which is something that I calculated separately for for your information, and I think that's a little bit more meaningful to people sometimes to know. So this is the monthly cost of living approximately in Greenville County, South Carolina, which I know we have some Greenville County people here and some non-Greenville County people here, but we'll just use this as an example. And if you wanted to use, if you wanted to pull up this monthly cost calculation for your own city or county, then you can just go to the source at the bottom of the page, the Economic Policy Institute, and pull that up according to your needs. But going back to Greenville County here, one of the things I really wanted to highlight is this low cost of childcare that they're indicating of $492. If you look at the data book, the average percent of median income required to cover full-time child care for an infant in a child care center is 32%. And so that again highlights how low this estimation is. And there could be lots of reasons for that, but I think most of them center around the fact that this perhaps could be a family center, like a home-based, family-based center of care, or it could be a low-quality care center. So I wanted to highlight that. And then can you click one more time, please, Lisa? So thank you. I also wanted to highlight the annual total that is estimated to be needed to get by in Greenville, South Carolina annually, and then contrast with the fact that the average South Carolina income, excluding the top 1% of earners, is $38,646. So if we think about that, and then the fact that like 36% or 32%, I mean, of that income is needed for childcare, you can see that that's pretty significant. So that's also a 25% difference from what is needed to meet the low estimates of monthly costs to live in Greenville County. And then also I've highlighted here that the average South Carolina child care worker makes $20,370 a year, which is also in the data book. But I did a little bit further research because that seemed high to me based on a lot of other information that I have about childcare workers. And what I found was that the median salary for South Carolina childcare workers is actually $17,950. But even using this low estimate for childcare cost, $492 a month would be 33% of a childcare worker's salary. Okay, can we go to the next slide, please? So now I wanted to show you a little bit about prenatal care and preterm births. So from the data book, again, let's see what page we're on here. If you're following along in the book, you can, okay, yes, page 29. 7% of South Carolina mothers received late or no prenatal care. Now, let me back up for a second and just say that prenatal care is important for a plethora of reasons, including but not limited to increased likelihood of giving birth to a healthy infant, improved dietary, physical activity, and environmental choices, opportunities to uncover abnormalities and or health problems, maternal and fetal, management of pre-existing conditions, healthier environmental choices postpartum, increased well baby visit participation, increased likelihood to breastfeed, and yeah, that's the rest. Sorry, my pages are not numbered. So here, I wanted to use this graph to highlight the trend, beginning with the higher percentage of mothers receiving late or no prenatal care by race. And these are the U.S. numbers that have been pulled from the CDC Wonder data. Now, Lisa, if you can click again, please. I'm going to show that the South Carolina preterm birth rate for all mothers is 11.2%. Will you click one more time, please? And so this is a calculation based on the total number of South Carolina low weight babies, excluding those who indicated more than one race. The numbers were a little tricky, and this was the best representation of different races for this data point. So if you look at this, I just want to point out that that minority children, still there are more of those in the low weight birth category than white, non-Hispanic white children. Okay, so will you go to the next slide, please, Lisa? And so then I want to highlight, so if you calculated this indicator by race, this tells the story, I mean, even more, what's the word I want? It really shines a light on the fact that we are lacking in optimal prenatal care for our minority populations. And so that's what this is. And this data is actually in the data book, like I said, on page 29. So I wanted to give you a little bit more background on that. So again, these disparities appear to begin with prenatal care and then continue through birth. Okay, Megan?
Great, thank you. And so Amanda has started to take us down the next path for our conversation, which is this report has a plethora of data in it. How can you use it for action? A lot of times, excuse me, with complex problems and challenges facing families, it becomes easy to sort of focus on one indicator, but we sort of risk tunnel vision with that and risk not seeing some of the systems level issues that might be at play there. And so this conversation about preterm birth doesn't happen in a vacuum, right? When we look at the data, we can see that some of the indicators sound the alarm early, tracing back to prenatal care access. And so we're going to talk a little bit about how we are using the data book at ICS to help shift away from deficit thinking towards strengths-based policymaking, how we're using it to inform our practice and our policy, and some reflections on how we, think that you all might be able to utilize that as well. Lisa, next slide. So the first thing that I want to talk about a little bit are social determinants of health. And that might be a phrase that is familiar to many of you. I feel like it's actually a very hot phrase right now, right? Last year's phrase of the year in this sector was resilience. I feel like social determinants of health is having its moment right now. I'm seeing it in sources I never thought I would see it before. What are social determinants of health? The fact of the matter is that things like our blood pressure number and our weight and even our family history are a very small piece of the total portrait of individual and community health. The factors that drive our health are the everyday environments in which we live. It's not a surprise or a mystery, for example, that a low-income family living in a low-income neighborhood may be more likely to have certain health problems than a high-income family living in a high-income neighborhood. There's environmental factors related to broken sidewalks and car exhaust and no safe places to get some exercise, all of which are so intertwined. Social determinants of health really get to the cross-sector systems level nature of the work that we do. It's why our data book looks at 4 domains of indicators and not just, say, academic outcomes, because we recognize that the child and family well-being is a much more complex picture than that. So I want to introduce the social determinants of health, which are defined by the World Health Organization. There's slightly different terminology from different sources, but this is the sort of neat and tidy summary. Economic stability, education, social and community context, health and healthcare, and neighborhood and the built environment. One particular thing that I like and that we like about this framing is that the World Health Organization states these in relatively neutral terms. They're not saying low income versus high income, they're saying income stability. They're saying social and community context, which is really a very difficult indicator to capture sometimes. We try to do a little bit of this in the data book, but it's very difficult to capture. What does the support network of a family look like in their environment? Maybe they're not turning to formal institutions, but there's a neighborhood association or a church or extended family members who are providing some of that support. And how do we move forward as a field, getting more sophisticated, and how we take that into account? And so it's a relatively neutral framing in the social determinants of health, and there's good alignment with a lot of the work that many of us are already doing. This is just helping to put some language around some of the work that we're already doing. Lisa, the next slide, please. This is moving even to the next level, right? So if social determinants of health are neutral language, this slide helps us shift from the deficit thinking to flourishing. Some of you were with us back in February at the Nurturing Developing Minds conference, which we hosted with Greenville Hospital. And our keynote speaker there was Dr. Christina Bethel, who specializes in child flourishing. In fact, the research institute that she heads up at Johns Hopkins collected many of the data indicators that we use in this report on some of the harder to measure things like family engagement. How often does your family eat dinner together each week? How often does somebody read to your child? The types of things that we don't have in administrative data systems, but really help give us a sense of some of the strengths that families are bringing to the table. And so I share this graphic from a report that Dr. Bethel and her colleagues have worked on to sort of show for you all what's informing our thinking behind the data book. Again, it is not data for the sake of data. It's data and assessment to introduce at all the different points of this little graphic that's in front of you. So the context, what does the landscape look like? When we start a project, we immediately do a landscape analysis, starting first the quantitative data and then getting into the qualitative. What are the organizations on the ground who are working with families? What do we need to know about service provision? What do we need to know about barriers to that? Moving on to the protective and promotive factors, not thinking about what are the indicators that a family needs intervention, but what are the strengths that a family, an individual, a community is bringing to the table? What can we learn from the data to help build those up? Then getting into the risk factors and identifying where there might be some benefit to intervention in terms of boosting some of those outcomes, and then taking a look at supports and services that are available. And you'll see here that the domains that they identify in their work on flourishing are in pretty close alignment with the domains that have shaped our data book. And so this is sort of the soapbox section of the webinar where we talk a little bit about why this work is so important and using this data to move forward and to help shape trends. When we get to the very end of the webinar, we have a slide of additional resources, and you'll see that on there, one of the resources is called a toolkit. Now that's something that we've just launched today, actually. That repackages the different components of the data book to make them a little more user-friendly for all of you who are not just looking for something really entertaining to read, but to really start utilizing this information in your practice. It takes each of the 4 domains that were in the report and breaks them out into separate documents. Perhaps you're chairing a committee or a working group in your community or with your local hospital or foundation focus on physical health. You can then just print out that physical health brief without the other 32 pages of analysis. We're also making available the full data file of indicators. So rather than trying to pull out the indicators from a PDF to make infographics like we've been using in this presentation, you can just go right ahead and get those out in an Excel file, complete with citations to trace you back to the primary source. We'll be archiving this video of the webinar as well. And then the final resource that we have up there right now is a link to the blog series that we've been doing on this. So taking all the indicators from this report, it's 80 plus indicators, it's already 50 pages. We couldn't write any more in it than what we already said. But these are complex issues and they deserve a deep dive of conversation. And so we've already posted one blog on income sufficiency and why looking at poverty itself isn't enough, and why we looked at indicators of poverty and median income in the data book. Amanda has in the works a pretty comprehensive look at breastfeeding and lactation policies to support family well-being. We'll have some others coming out about the role of extended family, about the Early Childhood Common Agenda in South Carolina. So again, that link will be at the end of the webinar and will take you to this wealth of resources that we're building up. We're going to be posting some visuals and infographics as well. It's also very much a living resource. If there is something that you are looking for or thinking, boy, that would be a really interesting visual or blog post, we're happy to take that feedback. There's contact information on that page as well. But really, we want to be sure that this is a resource that we are utilizing, that you are utilizing, and that we're helping to really chart a path forward for the children of South Carolina. So at this point, Amanda is going to, now that we've talked so much about how wonderful everything has been, Amanda is going to talk a little bit about some of the things we learned in the process.
Well, we learned a lot, and I don't even think all of it's going to fit on this slide, but that's okay. So the things that I think would be most interesting for this audience is that many of us know there's no such thing as perfect data, and it takes a lot of time to really dig in and try to find the original sources, which is what we did. We really wanted to get as close as possible to all of the original sources so that it would be easier for anyone who's using this data book to be able to go back and look at those numbers, and then even be able to dig in a little deeper on different subjects if you would like. So we've, since publishing the data book, we've already heard some great feedback from some of our friends and partners that we use some sources of data that they found to be problematic, but I don't think that they're so problematic that the use of the data will be able to. I mean, you won't have issues using it and as a proxy or a really good estimation of what is actually going on. And of course, if you actually have or a link, if you have, or if you know of a link to a better source of data or the actual data, I would love to hear about it. And I know that the rest of us at ICS would as well. So that's what you see here. I've heard that childcare aware can sometimes be problematic, but it is a very widely used source of data. And I don't think anybody should be afraid to use what exists. Just know that it might have some limitations that someone will bring up if they are aware of that. Same for when men murder women, and then PRAMS. The CDC has made very clear that there has been a lot of issues with collecting the PRAMS data in the last couple of years, so they don't feel that it is as reliable now as it used to be. So either we can use other sources of data, and I think we have done that in several instances in our data collection and analysis here. So just know that. So we also found that there was some data that just hadn't been collected or analyzed or produced at the time of producing this data report. And we also know that there are protected data sets that perhaps we didn't even know about and would like to know about in the future when we do this again. Oral health is something that you'll see in the data book. the Surgeon General has actually solicited some comments on what should be included in the new upcoming release of a report about the state of oral health in the United States. The infant and toddler mortality and injury was just a source of rabbit hole after rabbit hole after rabbit hole to try to find exactly what it was that we were looking for. So instead of including that data explicitly in the data table, there's a separate table about that on page 19, and that is something that we have a little bit more insight into maybe how to go about that, but it'll still require a little bit more thinking and analysis, but that's something that we would like to dig into a little bit later. Childcare is something that we know, and this ties in a little bit with workforce, particularly in South Carolina. The sources of data are not either unavailable or incomplete in many cases, and I think that actually I found out the other day that DSS is working to improve that and has just received approval to collect workforce data. And so I think that's very promising and exciting for future data collection. So if we can just move on to the next slide, that'd be great. Thank you. And so, yeah, some of the indicators that we wish we had included, one of them was maternal mortality. This is a really cool slide, Megan. The Google trend here is just showing the increase of maternal mortality. And this is something that's been in the news a lot lately. And yet when we were looking at and reviewing the data for inclusion, I don't even know why. It was like kind of in our heads, but it just wasn't something that came out that we included. But clearly it's very problematic, and it deserves a little bit more research on our part and others. Okay, can we get the next slide, please? Here is another one. This really shines a light on what has been in the news a lot, and that is the inequity in treatment for mothers and responding to their needs during the birth process. So I see, Megan, you've got a couple of notes here that I'm just seeing now. I'm sorry. This was, Megan, do you want to jump in here real quick, or?
I would love to, in particular, because as luck has it, as luck always has it in this field, I was on a 2-hour call this morning specifically about maternal mortality, and it just made me think all over again, how did we miss this one in the report? And this slide is partly our way of acknowledging that shortfall in our data collection. As an organization with a 2-generation systems level focus, we recognize that what happens to mothers is essential to what happens to children. We did include this year, for the first time, some more robust information on child mortality and the causes of child mortality, which is very difficult to get for a clear cross-state comparison. We dug a lot of data holes trying to find that one, and it was difficult. We found national level child mortality statistics. But somehow the maternal mortality conversation just sort of fell off the table, and we're going to have a blog post out soon about that exact issue. Part of it is because during childbirth, there's a point where the focus shifts from the mom to the baby. And so at that point, we were talking about prenatal care and we were talking about birth, and then we switched over to focusing on those indicators of very early child well-being. What is the birth weight? What kind of care is the baby getting? Are they going for their 6-month well child visit? And lost focus on the moms. And that, unfortunately, is part of what's happened to those moms and why these numbers are so startling. And so again, I was just on a call this morning bringing together this cross-sector group. Maternal mortality is really the hub of where a lot of different threads in this field come together about healthcare access, about racial inequity, about geographic inequity. Georgia actually leads the entire country in maternal mortality. A mom has a greater risk of dying as a result of childbirth there than anywhere else in the country. The rates in South Carolina, especially for Black mothers, are sobering. This is a rate per 100,000 births, but these numbers are still concerning for the wealthiest country in the world. In particular, this is going to help lead us into one of our forthcoming spin-off projects. It's not up on the toolkit yet, but we're going to be able to draw some international comparisons. Several of the indicators in our data set align with sort of best practice data measurement in international indicators as well. So for really the first time, we're going to be able to put out some infographics to help show how South Carolina as a state would look if it was its own country compared to other countries. And we're also going to be taking a look at these subgroup populations that Amanda has, focused on as well in the earlier conversations, that outcomes don't look the same for South Carolina families depending on who they are and where they live. And so for us, sort of going back and digging into maternal mortality after the publication of the report was a real wake-up call for considerations, not just in when we reissue this report in another 2 years, but how we can incorporate some of those data into our practice day to day.
Yeah, thank you. Okay, so now we do want to offer an opportunity for our audience to ask questions. If anybody has a question.
And I will tell you all what is on this slide that you are somehow unable to see. So, we'll make sure that you have this. And thanks again, everybody, for just being flexible with our technical issues today. As we've said throughout this webinar, it is a really robust collection of data, but we also know that it's not perfect. There are indicators that we could consider for the future, and we do intend to release this report again in probably about 18 months. New data isn't available frequently enough to merit reissuing it early next year. Many of the sources would still be old, but so we'll begin working on it again next year. If you have additional sources, indicators that you think should be considered for inclusion in this, we'll be working closely with not just our staff, but our research committee as we update the next iteration of this. So do reach out to myself or Amanda, and Amanda's information will be there in the contact information. The webinar will be posted as a recording. The data book continues to be available for download on our website. If you're a local organization and you needed copies for something, we do have some in office and could work with you on that. If you were looking for a larger quantity of those, more than say, 10, we might have to put in a custom order. But if you are having a meeting or a workshop where this would be a helpful resource, we're happy to work with you on that, and Amanda can help facilitate that conversation as well. We also have a link to our newly launched toolkit, which if you're on our homepage, you can actually just hover right over the research and publications tab, and you'll see a link for a data book toolkit. That will take you, it has a link not only for the full report, but for the domain by domain data briefs, the blog series, and we'll keep adding to that as we go, the downloadable Excel file, and we'll be adding additional resources and infographics there as we go.
I'd love to know if anybody has any questions now, even that they haven't typed in.
Yes, let me stop sharing, go back over there and look again. And while I'm hunting for that, I just want to reiterate what Megan said. Thanks everyone for your patience and bearing with us during our technical snafus, and kudos to Amanda and Megan for not missing a beat. Molly with Birth Matters, who is taking the lead in South Carolina for maternal mortality?
So I think the fact that there's silence on the phone means we do not know the answer to that, but we will find out. One thing to keep in mind is that since 2017, since this really new media coverage surge has begun on maternal mortality, we've been seeing an increase in legislative bodies getting active with the maternal mortality crisis. And so in most states, this is taking the role, and this is a call that I was on this morning with a different state, the role of mandatory statewide maternal mortality boards. In many states previously, maternal mortality review committees have been voluntary, or there's been a degree of discretion in what information has to be provided, a degree of discretion in what information is provided to the public. And so there are some dueling concerns here, of course. Thankfully, in the grand scheme of things, it's a small number of women who die every year. I mean, even one death is too many, but there's some real privacy concerns that a lot of states tend to have about that information going public. And so we've been seeing a lot of states putting together these cross-sector bodies of regulatory agencies, legislative representatives, and more interest group, advocacy groups, often the AAP, March of Dimes, et cetera, being at that table. I do not know for sure who is taking the lead on that in South Carolina, and if Brian or Amanda had more information on that, we can either please feel free to chime in now, or Molly, we will look into that question and share that response with the full group.
That's something that I've been wondering about myself. And I was wondering, if any of our friends who are on here from the hospital system might be able to share some information or weigh in, then that would be helpful. But otherwise, I just look forward to being able to dig into that and having a better answer.
I see that we have another question in the chat of, have we included data broken down by county? That is an excellent question, and thank you so much for asking it. We have not yet, and sort of put an asterisk on that one. So one of the things Sean Rusnak, our postbaccalaureate fellow, has worked on, and Sean, I know that you were coming from another meeting. Raise your hand if you're here, and we can try to unmute you. Yeah. One of the things that Sean has been working on, Sean is a shared fellow among ICS and some other entities in Greenville, is first identifying which indicators have alignment with available county level data. And so moving forward with the data book, one of the things we're going to be working on is sort of mapping it upwards and downwards, identifying which indicators have international comparison data and making those comparisons available, and then also identifying where there are county level data sets. So it's going to be beyond the scope of our work to put together another publication that has these breakouts for each county. However, the goal is to be able to drive folks towards where they can get that information for those county by county breakouts. As you can imagine, there's some challenges with this. The numbers just get smaller and smaller. Anything that's a survey, for example, some of those indicators of family engagement, they get much more difficult because it's just harder to know that you have every county sampled appropriately. However, South Carolina, the birth certificates that DHEC maintains are a phenomenal source of information. Everything about prenatal care and preterm birth and birth weight is available through DHEC's website on a county by county breakout. So for some of the administrative data systems, we do anticipate being able to put together a resource that can point you towards county level resources. We just won't be able to pull the information on every county ourselves.
I just wanted to throw in, Sean is on mute, but he just texted me that PRAMs can be done on the county level, leveraging sources like Robert, and you can also leverage sources like Robert Wood Johnson Foundation. I also saw the county health rankings when I was searching for some things. So I know that there are several sources that can be drilled down to on a county level.
Okay, Sean.
Yeah,
since
can
you
you
helped
guys
so
hear
much
me?
with this data book and you didn't get to speak today, we want to give you that opportunity.
Yeah, it was a great opportunity. I'm really excited the way that ICS is using it. As far as the county data, I think Megan spoke to it a lot, but there's a lot of sources out there that do have data at the county level. It's just a matter of digging through them. But for others, we just won't be able to get it because they just survey on a state level. But the data book overall, I think, is a great product. I'm really excited with what we have going forward with it.
Thank you all so much for joining.